So what are the key takeaways from this, then and now of this survey? Well, we found out that with increased exposure to telemedicine, thanks in part to COVID and the way everything was essentially forced to include telemedicine, it increased willingness and comfortability. And again, to point out that willingness specifically with exposure, it made people more willing to use telemedicine even when they're maybe not as comfortable. So previously in 2017, we were seeing that comfortability and willingness were essentially mirrored. Now we're seeing that they're not quite as mirrored, but people are still more willing to use it. Another thing that we were finding is that, again, established patient-provider relationships yield highest comfort and willingness. That's something that's expected. But honestly, in research, trust, and specifically within the patient-provider relationships, is not something that's very easy to look at and measure, but it is something that may be worth looking into more. How to increase trust when it's not just the patient provider, maybe it's the patient organization or patient to need for healthcare. So again, little things to think about for the future.